Hi, so you've seen one of these publicly accessible stop the bleed kits and you want to know what's inside. Well, let's have a look and see how you could save someone's life. A common but often preventable cause of pre-hospital death is severe external bleeding. Here we can see they're bleeding severely because of the blood on the clothes. You might see blood on the floor, and you may even in some cases see blood spurting or pumping from the wound. Either way, if someone's bleeding severely, they could bleed to death in a matter of minutes. When it comes to controlling bleeding, it's all about pressure, either pressure directly on or in the wound, or here we're going to try and stop it indirectly by stopping the flow of blood. And to do that, we're going to use a tourniquet from the first aid kit. Now, tourniquets are designed to stop the blood reaching the site of the injury. There are lots of different ones, but this one is very simple. I'm going to pass it around underneath the leg. I put this clip into there, and now we just pull it tight. Because I can't see where the blood is coming from, I'm just putting it up high and tight. And we just wrap it round and round, so that it makes a nice tight band and stops the blood passing down. Now, in the first aid kits though, there's also a pair of scissors. So we can do this again in a much better way. The wound tourniquet must be above the wound, about a hand's width above the highest of the wounds. And we can't apply it to the knee in this case, or if I was doing this to the arm, to the elbow. It's the same idea, put the clip together and then pull it tight. Tight is the trick. Then wind this material round, getting as much of the Velcro to stick as you can, and just wrap it round. Now I can see that the bleeding has stopped. I know the tourniquet is working effectively. Also in the Stop the Bleed kit is a small Sharpie type pen. We can use this to mark the designated area of the tourniquet to mark the time that it was applied by. This is a message for the medical people that will look after this person later at what time the tourniquet was applied. In some of the kits, there's a different type of tourniquet. They use a windlass, this rod, which you turn to tighten it. And this is the more common design of tourniquet. So if we've got one of these, what we do instead is we move it into position, same rules, above the wound, press this release button, and that allows us to pull the tourniquet tight. Tight is the trick. Now we can grab this windlass rod and we can twist this, and we keep twisting until the bleeding stops, and then we can lock it into one of these clips. Now we can get the material that's left and bring it round. This helps secure it and make sure there's no loose ends that can catch on anything. And then we can secure that in place with this strap. The strap has another job. It has a time thing, and we can write the time on there using the pen that comes with the tourniquet. This time, the bleed's not on the arm or the leg, and we can't tourniquet it. Injuries to the neck, across the shoulder, armpit, the buttocks, and in this case the groin, we're back to that direct pressure of putting pressure on the wound, or with big wounds, packing into the wound. Now, the Stop the Bleed kit comes with a special dressing designed for this, called a haemostatic or clotting agent, in this case, one called gauze. The idea of this is that you take the gauze and you pack it into the wound. And it's got a special material on it that's going to help the body clot. One version is that you make a small ball with the first part of it, and you then push that into the wound. It helps you direct it towards the active bleeding site. Then, keeping firm pressure on that, we just continue to pack material into the wound so that we fill the wound cavity. The idea is that you keep packing and packing and packing in this method until you've overfilled the wound site and you have like a mushroom on the outside. This will then allow you to put pressure over the top, and firm pressure has to be applied for about 4 to 5 minutes for this to work. In this case, we have another bleed which doesn't seem to be so severe. It's on the arm, and as I have my scissors, I can cut the clothing to expose the wound. And yet we can see that this bleed isn't as bad. It doesn't require a tourniquet. In the kits though, there are pressure dressings which we could use in this situation. Very simple. Open it up and put the pad over the area of the bleed. Then wrap the dressing around to maintain the pressure. At the end of the dressing, there's a small piece of Velcro which can be used to secure it in place. In the Stop the Bleed kit, there are some silicone gloves. These are designed that you can wear them if you choose to do so, and they will protect you against blood and bodily fluids. So if someone loses a lot of blood, it's possible they'll go unconscious. And once they're unconscious, they can't look after themselves. So you need to do it for them. We're particularly worried that they could swallow their tongue. If you've had first aid training, this is where your head tilt, chin lift and recovery position would be useful. If you haven't and the person's unresponsive, roll them onto their side and this will stop them swallowing their tongue. When someone is stabbed or shot, it's quite common for them to have multiple injuries. So we need to check the person all over. And when we look at this person now, we can see that there's blood on their shirt and their breathing is noisy and difficult. These are all bad signs. So because I have my scissors, I can try and expose the wound. And what we can see is there's a hole in this person's chest. When we breathe normally, we suck air in through our mouth, and this hole is totally interfering with that process. So because it is above the belly button and beneath the chin, we need to seal this. In the public access stop the bleed kits, there is a chest seal, in this case the Fox seal. This is designed for exactly this job. Now, even just a hand over this will help, maybe some plastic as an improvised method, but if we have these, we should use them. When we open it up, we get a big sticker that has really got a strong glue on it. This is so it can stick to people that have got a bit of blood, sweat, hairy, it doesn't really matter. But what we do is we peel this off the back and we're going to apply it over the wound. Ideally, just as the patient breathes out to the maximum. So now that we have our chest seal on, we have sealed the chest, and this should stabilize the person's breathing. If it continues to get worse, and by worse I mean noisy, difficult, check that you haven't missed any other injuries on the person anywhere else, and make sure help is on its way. Maybe there's a problem with air stuck in the chest. These have valves on it that should let it escape, but the person's obviously going to need more medical assistance. If someone loses a lot of blood, if they're laying on the floor for a while, or if they have all their clothing cut off, or in this case all three of those, they will get very cold very quick, even on the warmest of days. When we get cold, it affects our blood and it stops it clotting properly. And when the blood doesn't clot, we bleed more, and when we bleed more, we get cold and we get a vicious cycle going. So it's important we try and keep the person warm. In the Stop the Bleed kits, there is a thermal blanket. You'll know it as a space blanket. Get that out and use that on the person. On anything but the warmest of days, you're going to need something else, maybe a couple of them. But get something underneath the person and then wrap them up, and it will help protect them against the hypothermia, the effects of the cold. Don't forget to give the person tons of reassurance, even if they're not talking back to you, and obviously make sure someone's called for an ambulance. So now we've seen what's inside the publicly accessible Stop the Bleed kits, and you know how to use it. Obviously this doesn't replace formal first aid training. Try and get yourself on a course, but at least now we have the basic ideas of how we could save someone's life.